If you are pregnant or you've recently had a baby, this podcast is for you. I am your host, Kath Bequee, a physiotherapist working in women's health and mum of three. Inside my online program, Fitness Mama, I just love helping support women to care for their bodies during pregnancy, prepare their bodies for birth, and support their after-birth recovery, helping them feel confident and strong inside out during this important stage of their lives. In this podcast, join me each week as we dive into all things pregnancy care, childbirth and postnatal recovery, helping you through every step of the journey. It is absolutely possible to feel amazing and confident in our bodies during this motherhood journey, and I want that for you. Come and say hi to me on Instagram at @fitnessmama, and let's dive into today's episode. Hello and welcome back to the Pregnancy, Birth and Recovery podcast. Mastitis and breastfeeding. It has been definitely a while since I've done an episode on this, so I'm really excited to be joined by Dr. Nicole Gale today to discuss everything about what is mastitis, what do I do if I've got mastitis. We talk about treatment options and management, prevention of mastitis, and tips for pregnant women who are listening. So Dr. Nicole Gale is a general practitioner and lactation consultant who works exclusively in breastfeeding medicine and maternal infant health. Dr. Gale addresses complex perinatal breastfeeding and mental health concerns in consultations in her private rooms at Juno Specialists. She is the founder and director of this service, and it's based in Richmond, Melbourne, Australia. She believes in holistic, comprehensive, and evidence-based care and is passionate about healthcare professional education. She is also co-chair of the board of Breastfeeding Medicine Network Australia and New Zealand. So this discussion today, it's great. We go into a lot of detail. And the first half, we discuss, as I mentioned, what is mastitis? What do we do if we've got mastitis? We discuss different treatment management techniques, including lymphatic massage, ultrasound, and medications, and prevention practical tips. We did go on a tangent. It was a really good tangent, but it was nearly 20 minutes where we started talking about some less common topics. So I guess we did go into 20 minutes where we just started discussing inflammatory breast cancer, abscesses, milk blebs, and then we talked about different microbiome, including ductal dysbiosis and probiotics. So what I did actually do is I took out this, it was nearly 20 minutes worth, and I've put it at the end of the podcast just because I know, although these are really important topics, I didn't want them to, I thought they'd be better off at the end of the podcast episode for anyone who has a special interest in those sections. So we've got the main mastitis topic at the start, and then you'll hear me jump in and say, okay, now we're going to cut back to the abscess, milk blebs, microbiome, and inflammatory breast cancer topics. So it'll all make sense, but this is an amazing episode. I trust you're going to love it. Let's get straight into it. Nicole, thank you so much for joining me today on the podcast. It is so great to finally chat.
Thank you. Thank you so much for having me. I know I'm excited. I'm excited to chat today too.
We've been talking about this for about 2 years now, so it's here. I think it was 2 years when we first met.
Everyone has busy lives, I think. But that's okay. That's all right.
Absolutely.
We're here today. We made it happen, 6 kids and all.
And you, exactly. And you've just relatively recently opened up your amazing clinic, Juno. How old is that now?
It's almost 18 months old now. So
see, there you go.
I know. That probably also explains why it's taken us so long. But time just ticks on. Yeah, coming up to 18 months.
I actually genuinely would have thought you'd say maybe 6 to 8 months. I would not have.
Yeah, no,
Oops. Okay, I might
no,
edit that out
okay.
on the
That's all
podcast.
right. I think it's very new still. I think for
Yeah.
any business and establishing and having people come together as a team, I think I'm trying to build something for the long term. So
Yeah.
we're still building, but it's been beautiful.
And it's such an amazing space from what I've seen. And look, we are going to dive into everything mastitis and
Yeah.
so many great questions. But I do just want to ask with Juno, because
Mm,
you had this vision years ago when I first met you. What made you want to create this clinic, this
yeah.
beautiful space that you've got?
I had this dream when my eldest children were 1 year old and running around in the front yard. I remember where I was, and that would have been 2014. So it's been brewing in my mind for a long time. I wanted to create a space where you could have everything in one spot and you could create a really holistic, loving, community based space with time because I realized that there are the skill sets out there within the practitioners who work really, really hard when caring for families, new mums, and babies, but everyone can get quite siloed.
Mm,
And I thought, wouldn't it be wonderful to have a space, have this expansive space where we could really marry everyone's skill set, which is all so important, not just medical on one side, allied health or integrative on the other side, but actually everything together with community. And
yeah.
yeah, it took some time. When I had the idea, it wouldn't have been the right time. I had small kids and I needed to grow and have the experiences that I had. But once my youngest was at school, I thought, oh, maybe I have capacity to do this. So
Yeah.
yeah, it's been coming a long time, and I think I started working on finding space in 2022. So
Mm,
it took a long time, but I'm so pleased. We're so wrapped with the space. Uh,
yeah.
yeah, for the
Yeah.
families and also for us to work in. It's a joy.
Absolutely. And well done for creating that beautiful space that you have. And you've got quite a unique background,
Yes.
being with your medical side and
Yeah.
then with your love of everything lactation and that postpartum side of things too. At what stage did you decide to, well, how did the transition occur? Like through
How did
your
that happen?
medical, how did it
How did
happen?
I end up
Yes.
where I am? I it was having been pregnant with and birthing my first two children who were twins, and I had been working as a GP, and I thought, I mean, through that experience, it was challenging in lots of ways, and although I had people who cared about our well-being, it was all very fragmented and difficult to manage.
Mm, yeah.
And I thought, if I'm finding this difficult and I have all of the privilege and education of being able
Mm,
to navigate this system as a doctor, how on earth does anyone else navigate this?
yeah.
And so I started to have more of an interest in that postpartum, perinatal, and breastfeeding time. And I
Mm,
just worked at it over a long time. So
yeah.
I saw lots of people, had long appointments, did lots of education, and became a lactation consultant in 2019,
Yeah.
and had more and more interest in breastfeeding medicine, which is a little known specialty of
Mm,
doctors who have an interest in lactation medicine and breastfeeding, but also obviously have the medical knowledge. And there's more and more of us out there.
yeah.
I also joined the Breastfeeding Medicine Network of Australia and New Zealand and did education with them. And now I'm co-chair of the board of that. And so we run
Ah,
educational events for doctors and
yeah.
anyone else who wants to come along, health professionals, trying to increase education for doctors specifically to increase the standard of care that they're
Yeah.
providing when they're coming into contact with new families who are breastfeeding.
Yeah.
And it wasn't so much the breastfeeding per se that was important to me. It was that I felt like women were not being supported in their choices of how they wanted to feed their baby.
Okay.
Um,
Yeah.
and of course, breastfeeding is one of those ways. So,
Yeah.
um, yeah, it's just
Okay.
expanded over time.
Did you know one of the best ways to support your postpartum recovery is through exercising carefully during pregnancy and preparing your body for birth? And this is something we cover inside Fitness Mama. This is what fitness is all about with its physio-created workouts. We help you support your changing body during pregnancy, whether or not that's with pelvic girdle pain-friendly workouts, whether or not that's with strength training for pregnancy or pregnancy yoga. We help you to prepare your body for birth and reduce your risk of third and fourth degree perineal tears and episiotomy. And we help to boost your postpartum recovery, whether or not you've had a vaginal or a cesarean birth. If this is something you want to do, then come and check out our free 7-day trial. You've got nothing to lose, everything to gain. And at the end of the day, it's all about helping us have a better motherhood experience to help us feel stronger inside out in every aspect of our life: physical, mental health, confidence. Anyway, I could keep on going, but come and check out the link in the show notes and join our free 7-day trial. See you soon. Yeah, no, absolutely. It's amazing. So, look, because I've got, it'll be so great to have your medical background with these questions. So let's dive into it. Before we get into the nitty-gritties of like mastitis and treatment and prevention and, so all the
All of
questions.
the
I just
things.
want let's get so we're all on the same page. Can you
Mm.
please explain for those listening today, like what is mastitis or like, and again, I know that's not a simple question. It's an umbrella term, but what is it so that we're all on the same page? And how common is it to have it in those early weeks and months postpartum?
Mm. I think it is a simple question to answer. So mastitis is inflammation of the breast. So mast meaning breast and itis meaning inflammation. So mastitis means that a woman or a feeding person will have a area of the breast that is inflamed, and that might look like a bit of redness on the skin. There might be a tender lump. There could be a bit of an ache and painful feeling. That could be during feeding or between feeds. It could look like the person having individual symptoms that their immune system is activated. So that could be fevers, sweats, nausea, fatigue, aches and pains. And that's essentially what mastitis is. The debate, I think, where some people might have controversy around it is in relation to what causes mastitis. So there's always an inflammatory process going on, so inflammation in the breast. And sometimes it can be the inflammatory process alone, and other times it can involve infection within the breast as well,
Yeah,
um, driving that process.
yeah. And so you don't tend to use like the broad umbrella term like inflammatory conditions, lactating breast, and then you've got the infective side with one. Like, do you just label it all sort of mastitis, and then it's either infective mastitis or non-infective mastitis,
Yeah,
just to keep
so
it simple?
I tend to label it, although it can be a bit tricky to determine between infective versus inflammatory mastitis. I tend to label things as an infective mastitis versus more of an pure inflammatory. But actually, I like to use the term mastitis spectrum conditions, which
Hmm.
sounds a little bit confusing. But actually, what we do know is mastitis is just one part of a spectrum of inflammation within the
Hmm.
breast and engorgement, and it can be mild or it can be severe. And sort of down the mild end is a breast that is engorged, which means quite full, quite hard, can feel hot, red, and uncomfortable, but also has a lot of lymphatic fluid and congestion within the breast. And if that persists, that can tip into mastitis. into blocked ducts, which, if we're being technical, blocked ducts would probably be mastitis as well because it's inflammation within the breast, but then into mastitis that most people know it as, which is an illness that
Yeah.
makes them acutely unwell,
Hmm.
and into more severe versions of that with collections of infection and abscesses and things like that. So
Yep.
mastitis is one part of that inflammatory
Yep.
um, spectrum or mastitis associated spectrum conditions, of which the cause can be inflammatory, infective, or both.
Okay. So it's anything from a little painful blocked duct to full-on infection, aches and pains, fevers, the rest.
Yeah,
So how
yeah.
common is it?
Look, it's really quite common, especially in the early days. And around that time when a woman's milk comes in and she may have some engorgement, that's a common time to
Hmm.
get mastitis. In the first 6 to 8 weeks is relatively common when the milk supply is coming in and supply is establishing, and so that engorgement and that emptying of the breast is it's in a bit of a dance and it's settling
Mm.
over that time. And also, as the little baby learns how to breastfeed and empty the breast, and sometimes there can be trauma to the nipple, which can open up a route or a pathway for bacteria to get into the nipple and breast and create infection. So it tends to be more common in the early weeks and months, but it can happen any time that a woman breastfeeds. It can happen 4 to 6 weeks after weaning from breastfeeding, and it can rarely happen in between breastfeeding or when someone's never breastfed. But we
Mm.
probably won't go into that now because
Okay.
it's a whole
Yeah.
other kettle of fish. Yeah, it
Yep.
happens. Another common time is actually later on in the first year of life, in 6 to 12 month old babies, where they are dropping a feed or extending
Mm.
the
Yep.
time between feeds,
Yep.
when mums are running around a lot more and getting a bit more fatigued and
Yeah.
not feeding as frequently.
That's when
Uh,
I always ran into trouble when I
yeah,
was
yeah.
dropping a feed.
When that
Yeah.
milk just sits in the breast and starts that inflammatory cascade.
Yep.
Um, yeah, mastitis, although we're using it as a term in relation to this is a diagnosis, to me, it's not a diagnosis, it's a symptom because there's always a cause of
Mm.
the mastitis. And that's what I'm
Okay.
always interested in. Like, what has caused this individual to develop mastitis now?
Okay. Well, that let's go into that. And also, before I go into the causes of mastitis, but then I'd also love to just tick off what are there anything is there anything else that we should be aware of that it apart from mastitis that it could be that women need to be aware of, like any other red flags or anything like that?
Yeah.
So let's first of all go into the causes. Go for it.
Okay, so we've mentioned some of them. So
Yep.
infection is definitely common, and it's much more likely if there's been trauma to the nipple where you've
Hmm.
been able to have cracks and for bacteria to get in. It's most commonly caused by staph bacteria, Staphylococcus aureus that's on our skin, just the normal bacteria that's on our skin that can get in. And occasionally there are other bacterial strains that can cause mastitis. But the most common cause is staph on the skin that gets in.
So
Um,
do we always have just staph or just
yeah,
on our skin? I
yes,
didn't realize. Yeah, right.
yeah. So we have on our skin, we have a bacterial, fungal microbiome on our skin where
Mm.
we always have a balance of bacteria and fungi on our skin.
Yep.
And some of those bacteria, I'll talk about more specifically, are considered just normal part of what everyone walks around with, and others are less common or more likely to cause infection. But
Okay.
anytime, just in principle, if you've got a cut or if you've got a paper
Yep.
cut, it could theoretically get infected just with the bacteria that's on your
Yeah.
skin.
Yeah, right.
And
Yep.
that's what can happen at the breast essentially because sometimes the attachment, the baby and the mum coming together, they're still working that out. You can get
Mm.
that little bit of damage of the nipple and just that
Yeah.
normal bacteria can get in.
Yeah. Okay.
So that's one cause. Another cause, I do think there is pure inflammatory mastitis. Now, when you have infection, your body responds to that with inflammation. So there's always inflammation in mastitis, but sometimes it's more to do with congestion within the breast and the fact that that milk isn't flowing well. So the body gets a little bit irritated and there's more inflammation and fluid within the breast. And that's more of an inflammatory picture. And that would be where if you skipped a feed accidentally, or you had been stretching it out, or your little baby had slept through the night miraculously and you woke up in a panic going, oh my God, are they okay? And once you
Mm.
realize they're okay, you go, oh, I'm feeling quite
Yeah.
engorged and maybe a bit
Yeah.
uncomfortable. That's that sort of picture. So early on in the early days, I'm much more suspicious of infection. But later on, especially if there's not nipple trauma, a woman's much more likely to have an inflammatory cause.
Mm.
Um, there are other causes of inflammatory mastitis, and this sort of goes into red flags. So there is inflammatory breast cancer that can present. So um, most people may understand breast cancer as a lump within the breast. And often in your traditional breast cancer, that most people understand what it might be, is it's a relatively painless lump without skin changes and someone feels totally well. But there are other forms of breast cancer that are inflammatory and can look just like mastitis. So we always want to take any lump in the breast seriously, even if that woman is breastfeeding. It does open up a whole, what is likely to be the cause is different in a breastfeeding woman as opposed to a woman who's not breastfeeding with a lump. But we always want to make sure that someone is assessing that woman, supporting that woman, and that lump is resolving. And if it's not resolving, even in breastfeeding, that is a red flag where someone needs to go and
Yeah.
see their doctor or healthcare provider and have an assessment. It's not common, but it does happen, inflammatory breast cancer. So I
Yeah.
do always have that in the back of my mind.
Hi, ladies, it's Kath here. I'm just jumping in because this is where I'm going to cut some information about inflammatory breast cancer, abscesses, milk blebs, and microbiome, including ductal dysbiosis and probiotics. It's really important topics, but I'm just cutting them out here and I'm going to pop them towards the end of the episode. So stay tuned if you're after any of those topics. Otherwise, we're going to go straight into some treatment and management options now. So, but let's take it back to basics. Let's say someone's, you know, they wake up one morning and there's a bit of tenderness, a bit of heat, and they're thinking, "Oh my gosh, I've got a blocked duct. What should we do? What should this woman do? What's
The
I
first,
guess the cascade of treatment
yeah,
options?"
first thing you should do is continue breastfeeding
Hmm.
or pumping. You must continue to empty that breast. Otherwise, if there's infection, that can turn into an abscess. So I see abscesses form when women stop emptying the breast or when they're massaging really hard, but we'll come back to that. But you need to just keep that milk flowing. You don't want to increase how frequently you're emptying your breast with feeding or pumping. You want to just keep it at the same level because you don't want to drive your breast to produce more milk, but you want to make sure that you're emptying what it produces so that if there's infection, it's not sitting in one spot, it's
Hmm.
moving through. And if there's inflammation, the milk moving through, that just helps reduce down inflammation in the breast.
Yeah.
So the first thing you want to do is keep feeding. If things are painful, I would have, and depending upon what people can tolerate, I would have a very low threshold to have some ibuprofen, some Nurofen, some anti-inflammatories, not just for pain, but actually as a potent anti-inflammatory intervention. And I wouldn't take that ad hoc. I would take it with food regularly. And I would do that for a couple of days, even depending upon what was, how severe things were for an individual. Um, and you can do, and this is where physio and cath, what you do is you can do some very gentle lymphatic massage of the breast. But what we don't want to do is actually get that spot that is painful, get our thumb in there and push, push,
Mm,
push. We actually
yeah.
don't want to do that because you can imagine while that might push the milk a bit towards the nipple, what it does is it can traumatize this really delicate, already inflamed tissue. And there's milk that's still going to be
Mm,
produced and it can just create even more of a blockage.
yeah.
So we want for women to be relatively hands off
Yep.
their breasts.
And that advice has changed quite a lot in the last, I guess, decade even.
Yeah. I would
So
say
it's
5 years after the Academy of Breastfeeding Medicine Mastitis protocol came out.
yes.
Um, that moved
I,
more towards looking at mastitis as more inflammatory rather than
yeah.
infective. We do know that there's been quite an increase in abscesses after that protocol was
Interesting. Yeah.
released. So I think it's reasonable in a woman who doesn't have any fever,
Yeah.
who isn't feeling unwell or nauseous within herself, that she's just got a little bit of a sore, maybe red spot in her
Mm,
breast, to try to continue feeding, have some anti-inflammatories. I was going to get to it, use ice. So
yep.
using some ice, you can get some of those breast pad inserts
Mm-hmm.
and have in the freezer.
Yep.
You don't want to put that directly to the skin because
Yep.
that will burn. You can get burns to the skin from too cold. But if, 10 minutes every 3 to 4 hours, putting that on the breast after feeding.
What about ice massage, where you're just rubbing an ice block in circles? So you're not just sticking ice directly, but and it's melting, and you're doing a
Mm,
nice, like in a figure 8 around that area that's
I,
red and sore.
I think my only concern would be that could it be a bit too cold and give you a bit of a burn with that? Because it is still ice directly to the skin. So if the woman tolerates
Mm,
it, that's fine.
yeah.
I'm okay with that. But technically, they say not direct to the skin. Have you
Yeah.
found that helpful?
Well, we tend to, I tend to recommend the ice packs, like there's
Mm,
quite a lot of beautiful ones out there. But the ice massage, it's an interesting one because it's that perfect, like you wouldn't put a dry ice block directly onto the skin. You'd wet it first, so it's already got that layer of water and it's melting and you're moving it continuously. So it's not the risk of it sticking and creating that ice burn. And then you've got that lovely pressure that's similar to sort of the lymphatic
mm,
massage. So I was just wondering,
gentle.
interesting to get
No,
your
no,
thoughts
it's
on
really
it because I've
interesting.
often thought, oh, would love to do a bit of ice massage on that.
But
Um,
it would be gentle as well. I suppose if it's got a layer of water, then that's not directly from them.
no, yeah.
Have you recommended that for people? Have they found it helpful?
No, I don't. I've always want to, but
Mm,
I haven't. But I
yeah,
always think, um, yeah.
I've tried
Um,
on myself, but I'm not breastfeeding
yeah,
anymore.
I know. I was like, I need to find another breastfeeding physio or
Yeah,
lactation
I'm
consultant as a
willing to
guinea
give
pig.
it a try.
But I know that we recommend ice massage on lots of things, and it doesn't
Yeah,
cause, on other areas of the body, and it certainly doesn't cause. I'm not concerned about the burn. So,
yeah.
yeah. I do
I
just
think if
want to
you're
take it
moving
back.
it as well, if you're
Exactly. It's got
moving
the
it, I
layer
think
of water
that's
and
a
you're
bit
moving it.
different. Whereas if you just had an ice pack that you put straight on
Yeah,
the
no.
breast and it sat
Yeah,
there for,
definitely not.
then yes, you can.
Yeah.
Yeah.
And we're
Yeah.
talking about one little block as well,
Yeah.
not like a massive slab of ice.
Yeah.
But taking it one step back, just so that people understand that whole concept of getting that thumb in and massage, getting deep into that blockage versus the lymphatic massage.
Yes.
I like to liken it to a garden rope in the garden. If you were to
Mhm.
stand on that garden rope, hose, oh my gosh, sorry,
Oh,
bad night's sleep. Garden hose. If you were to
yep.
stand on that garden hose, you would block the flow of water coming out of the hose and it would build up. So
Mm,
it might start squirting out the other end of the hose, where it's attached to.
yeah.
So and it's similar. It's such small little ducts inside our breast where
Yeah.
if we're compressing it further, and this is where um, being aware of what we're wearing, like bras, singlets, and making sure there's nothing digging into the skin area, because it can be the slightest little digging in from a bra that's not fitting properly, or it's
Yeah.
something like that that can cause, it's like stepping on a
A
hose and then
little,
you've got the
yeah,
backlog happening. So the lymphatic
100%.
massage, yeah, it's like taking the blockage off and letting
It's a
the
great
flow.
tool. Sometimes in consulting, if I see a woman that has really bad mastitis and a really congested breast where there's not even much milk coming out, I will sit with her and do it with her during the
Mm,
feed
yeah,
for as long as she possibly can, and it's
yeah,
remarkably effective.
yeah,
But I
yeah,
think some women might wonder, well, if we're saying let's not really knead into that, where does that even come from? And I think it harks back to what we used to think mastitis was, where you'd have a tube and there would be a plug within the tube and you wanted to push that plug
yeah,
out.
yeah.
But what we now understand is it's like that garden hose. It's a plastic compliant tube. And it's not so much that there's a plug inside it, but outside you can have a lot of inflammation and that can
Mm,
squeeze the tube
yeah, the
shut.
tube.
So if you realize that there's no plug that you're trying to push out,
Mm,
then you
yeah,
realize that you just want to move the fluid in the breast. But I
mm,
think
yeah,
most people have never heard of lymphatic massage.
yeah,
Um, but it's a remarkable tool. I think it's a
absolutely.
really potent tool because you've got to get that milk flowing. Um,
Mm.
yeah. So I imagine you would be doing a lot of that in clinic, is teaching women how to do it.
Yes. So as a physio, women's health physio, we've got our
Yeah.
beautiful ultrasound machines, and we like can send like a um as we're doing ultrasound, which is sending sound waves into that area and helping with that blood flow and that, like what we were just talking about. But as we're doing that as well, it's you're doing it that really nice pressure that's helping with that lymphatic drainage. And on top of that, we teach lymphatic massage. Um,
Yeah.
yeah, it can be really helpful. And the nicest thing about it, I find, it provides so many women with immediate relief. Like that, and then they
Mm.
do a feed straight after, and
Yeah.
within an hour, we're getting an email or a call from the patient saying, "Oh my
Yeah.
gosh, it feels so much better." So,
Because we
and there's
know.
more and more research as well, which is
Yeah, we
backing it up,
know
which
what
is
we've got to
exciting.
do is move that fluid. We've got to
Yeah.
be able to keep the milk flowing. It's
Mm.
in the body, when anything sits in one spot, it's not good. There's a saying in
Mm.
medicine, stasis is the basis of infection.
Yeah.
So,
Yeah.
if you're going to the toilet, you need to keep going to the toilet. You need to do a wee. You need to,
Yeah. Yeah.
do a poo and not be constipated. And when you're
Yeah.
breastfeeding, the milk needs to be flowing
Yeah.
in order for the
Hmm.
breasts to be healthy. So,
Yeah.
yes, I mean, I see it time and time again where we've done all the other medical management, but actually they need some hands-on work
Mm.
that is really impactful. There's even variations on massage. There was a Japanese form of massage that I encountered with a lactation consultant once when I had mastitis, and I was in hospital and very sick because sometimes the infection can be very severe. So you can get very infected breast or breasts, and you can get blood poisoning from it as well. So I think there is a lot of fear because women fear becoming unwell. Um, but I was quite sick in hospital with mastitis once, and I had this amazing LC come in and do basically this Japanese form of massage, which was in retrospect a lymphatic massage,
Okay.
and that's what turned the corner for me.
Yeah.
And
Interesting.
I see it time and time again, and you would as well. So, although you
Mm.
may need, I mean, we've talked a little bit about continuing feeding, ice, anti-inflammatories, and lymphatic massage. Some women need more treatment, but that basic lactation management, that basic breastfeeding management is essential, even if you had really severe
Yeah.
mastitis in hospital.
Yeah.
Really important. So I suppose the other treatment option would be um, antibiotics. And this is the
Mm.
thing. So how do we tell what's just an inflammatory versus a mastitis versus one that has more that has infection and bacteria? if someone's unwell within themselves, so that means fever, sweats, all of those, nausea, fatigue, then I'd be a lot more suspicious of infection, and I would probably have a lower threshold for antibiotics. That
Yeah.
said, inflammation can make you feel like that also.
Mm.
So if it was a mum with an older baby who had skipped a feed overnight and felt a little bit fluey, I would probably not jump straight into antibiotics. I would give
Mm.
her 24 hours of some of that management to see how she goes.
Yeah.
But if I had a mum that was 2 weeks postpartum and had a lot of damage to her nipples and she had that, I would be putting her on antibiotics straight away because the
Mm.
risk of her having bacteria would be much higher.
Yeah.
So really, when would we use antibiotics? When conservative management isn't working, or when someone's
Yeah.
quite unwell within
Yeah.
themselves.
Okay.
Um, yeah,
Yeah. Okay, I'm aware of your time. Can we quickly discuss prevention and some practical tips? And
yeah.
then lastly, anything that if you're pregnant, oh no, let's quickly prevention,
So
practical tips in
prevention
one
is
minute.
frequent, flexible feeding. You want to just feed
Yep.
your baby as often as your baby wants. That
Yep.
is the most important thing you can do because it stops that milk sitting in the breast and
Yep.
setting up that inflammation. Also, you want to try and make sure that you're getting the baby on without too much trauma to the nipple where possible in the early days. So having really
Yep.
good breastfeeding support is the best thing you can do to prevent and not randomly skipping or stretching feeds in the early days. When
Mm.
milk production is getting established, you need to, even if you were separated from your baby or they slept longer, you may need to empty your breasts so
Yep.
that you don't have that long period of time between feeding.
And this is a really big topic in itself, but stress and sleep deprivation, how much
Oh,
do you find they play a role?
100%.
Yeah.
I say, if a
Yeah.
woman comes in with mastitis, I'm like, did you run around last week? No judgment, but uh,
Yeah.
you know, stress and sleep deprivation.
Yeah.
Also, illness. So, there is an
Mm.
association with viral infections. Definitely during COVID, there was an inflammatory mastitis that would happen with COVID as well. So, if
Yep.
you're unwell generally, that also
Yeah.
doesn't help. I think the other
Okay.
thing in terms of prevention, a real pressure point is when a woman's milk comes in and she's engorged.
Yeah.
So, one of the things that I think pregnant women would be good to just at least be aware of is something called reverse pressure softening. Have you heard of that, Kat?
No. What do you
Okay.
no?
So when the breast gets really full and you get that lymphatic congestion within the breast, it can shorten the nipple and make it less elastic. So that
Oh,
means that
yep.
it's harder for the baby to latch onto and draw the nipple deep into their mouth. And so you can get a bit more damage to the nipple and not as good emptying of the breast. There's a really simple maneuver where you can put your fingers right directly on either side of the nipple at, say, 12 and 6, and then 3 and 9 for 30 to 60 seconds. And that moves that lymphatic fluid away from the nipple, and you do that immediately before latching.
Hmm.
Um, so I wish they had posters of that up within maternity hospitals
Yep.
because that can be a pressure point when milk comes in. So maybe we could put a link. ABA has a really good
Yep.
has some pictures in their engorgement page
Okay.
way down
I'll
on
do
how
that.
to do that. If I'm doing antenatal education, I'm telling mums about reverse pressure softening when their milk comes in.
Yeah, great.
And also with engorgement, the most impactful thing you can do is just keep feeding frequently.
Yep.
So the thing that improves engorgement the most is feeding and emptying your breasts as frequently as your baby needs, not going, oh, I better not feed. If in doubt, go for it.
Okay.
Okay.
Final, super, really, this is the nice way to finish off. If someone's pregnant today, they're listening to this episode and they're thinking, oh my gosh, there's so much
Yeah.
information here. What's your final like tip, words of advice to this beautiful
Don't get
mama?
too worried
Yeah.
about it. It the individual person does not need to necessarily know all this detail. The take-home message is if you just feed your baby frequently and flexibly, that's going to be the best thing to reduce the chances of having mastitis. If you do feel that you get mastitis at some point, um, the ice, the same feeding, being very gentle with your breasts and some anti-inflammatories. And if you're not feeling well, see your doctor.
Yeah.
That's really the take home message. And it's just that there has been, after this protocol came out a couple of years ago from the ABM, there's been a lot of misinformation about mastitis. So I wanted to go into more detail because there has been such controversy, but for the person at home who's listening, feed your
Yeah.
baby frequently, get breastfeeding support early if you're worried, and just know that basic mastitis first aid. And if
Mm,
in doubt, then go see your doctor or your breastfeeding support person if
yeah.
you feel something's not right.
Thank you so much, Nicole, for joining me. I really appreciate all, you sharing all your amazing knowledge with
For
us
having
today.
me. Sorry I've gone on too long, but
It's been brilliant. Thank you.
thank
I'm aware your next patients are rocked up. I heard that little ding before, and I know that sound. We'll let you go. Thank you, Nicole. Okay, ladies, this is that little bit that took out from before where we go into inflammatory breast cancer, abscesses, milk blebs, and microbiome, including probiotics. Enjoy.
and so those red flags would be an area or a lump that's just not resolving.
Mhm.
Uh,
Yeah,
And we know that what you need in order to assess a breast lump is a really good examination, some imaging, which would be ultrasound when a woman is breastfeeding, because mammograms, you can't see through all the milk, and often a biopsy if we are concerned. So that's your gold standard assessment for a lump if things were not quite right.
And
That's
how
what's
long would you give it? Like, so, for example, I often see women who now help with ultrasound when they've got some inflammation of the breast and help to, remove any blockages and that sort of thing with
yeah.
ultrasound. At what stage, like how many days or weeks, like, do you have a time frame that you like to go by if it's not resolving by?
Depends on what's going on with the individual, but what I'm initially looking for in the early days is improvement, because a lump won't, a decent mastitis and a relatively painful or large lump will not go away within 2 or 3 days
Mm,
necessarily.
yeah,
It can take 2 or 3 weeks for a lump to go away. And actually, rarely you can get lumps that persist for a lot longer after that, but with following mastitis, but doctors would, that would be when we've assessed the lump and made sure that, everything's okay and that nothing needs to be done urgently. But essentially, if you're having treatment and you're not responding to treatment, then that needs more investigation. But if you're having treatment for mastitis, if you're on antibiotics and you know why it's happened, and you're a couple of days in and it's still, the lump is still there, but it's improving,
yeah,
then that is a really good sign. And I would often give it a week or 2 weeks for that
yeah,
lump to resolve. With infective mastitis, some women need courses of 2 weeks of 14 days of antibiotics. And I would uh, be accepting of any lump that is present during that time, so long as they were improving. But if you
yeah,
got to the end of your antibiotic course at 2 weeks and there was still a lump, then that definitely needs an
yeah.
ultrasound.
Okay.
Um, the other thing would be that if they weren't responding, if they were really unwell,
Mm,
that it would
yeah,
be worth getting an ultrasound earlier, or if the lump itself was really obvious in the breast, like almost a golf ball, or had features that felt like it could be an abscess, then we'd get an ultrasound
okay.
earlier as well. Yeah.
Okay. Now, on that note, I would love to touch, before we go into treatment for mastitis, I'd love to touch on abscess that you just mentioned and
Yep.
also milk blebs as
Yes.
well.
Yeah.
So,
What do you
yeah.
know? Where to begin? Maybe
Yeah.
we'll talk about abscess first.
Yeah.
Yeah.
Because,
So
yeah, go for it.
abscesses are a collection of pus. So they are infection. That's where infection, bacteria has gotten in and infection has really set up, and there's a little area where pus has formed. And they can be quite small or they can be quite large. But traditionally, abscesses need, unless they're very tiny, they need some medical intervention because there's this area of bacterial infection, and antibiotics can get around the edges of that, but they can't penetrate in very deeply. So if a woman had an abscess that was of a decent size, then they would generally need to have some of that pus taken out. So it's a
Yep.
needle and you pull the pus out. And
And
usually, yeah, it's
sorry,
doing
do
that
you do that,
pus.
Nicole, as a doctor? Or do you
I don't
get, is it,
personally,
no,
most
yeah,
GPs don't. I would be often referring to a breast surgeon colleague to do that,
okay.
or I would be referring to a radiology place with ultrasound
Yeah, right.
because it
Yeah.
depends on the size as well. So
Mm.
having that imaging to know where you're going,
Yeah.
and sending off that pus to see what kind of bacteria or bugs were in it. And most women may need that once or twice. Very, very rarely there'll be a woman who actually needs a little tube put in to help it
Mm.
drain. But they do tend to heal really well,
Yep.
abscesses. I think people feel quite afraid of them, understandably, but they do heal. They do heal
Yep.
quite well. Yeah.
And do you find that the mums you see with an abscess tend to continue breastfeeding post, or is that often a common reason to stop breastfeeding?
It's a mix. It's a common
Yeah.
reason to stop breastfeeding. I think it often depends on how large the abscess is and how
Mm.
bad the mastitis is, and the healthcare providers that they're seeing. So
Mm.
sometimes they will see doctors who will say, "Oh, you've got an abscess, you can't breastfeed, you have to wean." And that's quite devastating because that's not good management for mastitis. We want to keep
Mm.
draining that breast while there is inflammation or infection. But yeah, they can continue to keep breastfeeding. Some women have really large abscesses or they've had a lot of pain. And sometimes, if the abscess is quite close to the nipple, that can, as it heals, be
Yeah.
not painful, but have some scar tissue formation, and that can make latching difficult.
Yep.
So some women do choose to wean if they have an abscess, and some women will wean off one breast and continue
Hmm.
breastfeeding on the other breast as well. That's
Yep.
always an option because the
Yep.
two breasts work and produce milk independent of each other.
Mm.
So even if someone had a really horrible journey and they got
Oh,
to the
yeah.
point where they went, okay, I've got to wean off this
Yeah.
breast, um, you can often continue on the other side.
Yeah.
And I do see that as well.
And this is a little bit of a side question, but I always had one super breast. I called it my super breast.
Yeah.
Is it quite
Yeah.
common to have one breast that generally produces more milk than the other?
Yeah, we're not symmetrical as women. So
Hmm.
our nipples are different side to side and our breasts are different side to side.
Yeah.
And that includes the gland tissue that produces milk. So most women will have one side that maybe produces a little bit more, but sometimes that can be a bit of a self-fulfilling prophecy. Like a baby might have a
Yeah.
preference for one side or the other. And the more
Yeah.
you feed off one side, the more milk production
Yeah.
is going to be on that side. So it's sort of hard to know, is that underlying milk production or is that the pattern of
Yeah.
feeding? Is the baby feeding on both breasts absolutely identically? Usually not, but yeah,
Yeah.
it's quite normal to have one side that produces more than the other. And sometimes that's a big discrepancy and sometimes that's a small discrepancy.
Okay.
But we're humans, we're not robots. So yeah, that's
Okay,
normal.
let's touch on milk blebs and then it'll be great to dive into treatment.
Okay, milk blebs. So milk blebs, milk blisters are little white spots that can occur on the nipple. And basically they occur where there is an opening in the nipple where milk would be coming out, but skin grows over that and blocks that tiny little opening and duct. And so what you get is a little white dot or almost like a pimple that affects the nipple. And that can be quite painful because you've got milk behind that opening that wants to come
Mm.
out, but it cannot come out because there's that little bit of skin that has grown over it. Um, yeah, milk blebs. Yeah.
How do you treat that?
So I think there's actually a lot of debate about how best to treat. So I go through what all the different options are. Again, I always wonder what's caused it. So we know that women who have um, a really generous breast milk supply are more prone to blocked ducts. There seems to be some women also who have potentially um, a very low level of infection within the duct that can drive it, and drive them to be what's the word, to form.
Yeah.
But then also, I think mechanical irritation of the nipple can do it. So if you think that you've got a little area on the nipple that's being irritated, that could be infection, that could be a lot of pressure from behind the breast with milk, but also if the latch between mother and baby isn't quite right and you've got some of the nipple that's
Mm.
rubbing, then the
Yep.
body tries to do the right thing and heal that area, but
Yeah.
that healing
Makes
tissue
sense.
is a bit overzealous and inappropriate.
Yep.
And so it can grow over. Um, Different people have different opinions about how to manage them. What we do know is they are really tricky to manage and they're often chronic. So
Mm.
there was a study a couple of years ago that came out that showed that the shortest duration of milk blebs um, was around 8 weeks and the longest was up to 15 weeks.
What,
So
8 weeks?
I
I didn't realize it was that long.
Yeah, so
Wow.
some women do get one and it just resolves itself quickly. I do see that happen. But often, if they're coming in to see me with a milk bleb, I go, this is probably going to grumble along for a little while,
Mm.
no matter what I
Yeah.
do. If it's really tense and new and you've got all of that pressure behind, I do, with a needle, do a procedure and I do open up that little duct, which isn't painful. But we
Yep.
don't generally advise women to do a lot of that at home because there's
Mm.
a risk of introducing infection
Yeah.
and
Yep.
trauma to the area. And if you've got that area that's already trying to heal somewhat appropriately or inappropriately, if you traumatize it, that's just going to set that up
Yeah.
a little bit
Yep.
worse. Sometimes what you can do is you can use warm compresses to try and just soak that skin and see if it will come away. And they talk about Epsom salt soaks as well. That's trying to
Yep.
dry it out and open it up. And I think that does work for some women, using a flannel to just try and irritate or rub at the end to try and get that opening to come away.
Yep.
Um, but I don't know how successful that often is for women.
Mm.
Um,
Yep.
and you don't want to be
Tricky.
scrubbing on the end of the nipple constantly either.
Mm.
So, and also being mindful that if a woman felt that she needed to sort of release it at home, that she would need to do that in a very sterile way if she did.
Mm.
Um, I use sterile needles and things in clinic, but
Yeah.
I've seen women that have said that the pain has been worse than labour and presented to
Oh.
Royal Women's Hospital, and people haven't known what to do. So they can be very painful, and
Mm.
they can be quite new and sudden onset, but they can grumble along and become chronic. And those ones can look a little bit more red. There's less of an obvious white dot. And they're often we don't take the roof off of those.
Yeah.
Um, some people don't touch them at all. So
Yeah.
there's disagreement. But I feel if a woman has pain and you've got a very new milk bleb, I do prefer, if possible, to take the roof off and then put the baby on to feed to
Yeah.
draw all that milk out from
Makes
behind.
sense.
There are other things that people can try. So some women do find that soy lecithin supplements can be helpful. I don't find that that's always that successful, but I think the risk of harm is pretty low. And that comes out of some of the theories of why this might form. Could it be to do with an abnormal balance of bacteria within the breast duct,
Hmm.
or sort of thickness or viscousness of the breast milk, with this idea that lecithin might thin that and make it more lubricant to come out.
Yeah. Right.
Most women I find don't find that overly helpful, but I've had an occasional woman who's tried it and she said that's made the difference for her. There's lots of things about the breast that we don't know. So
Mm.
it can be a
Yeah.
bit tricky. If the woman has a really generous supply, actually trying to dial down her supply if she's got too much milk can be effective as
Mm.
well. That can
Yep.
help. And I will often send off milk cultures, or if there's any suspicion of mastitis at the same time,
Mm-hmm.
I'm a lot more suspicious about infection. And
Yep.
so for some women, that's part of that infection spectrum. And I will use antibiotics for that occasionally.
Interesting. I was going to save this question to the end, but microbiome and probiotics and, for recurrent mastitis, like what's your thoughts on probiotics and all that side of things?
I love the idea of probiotics, and I think that there is definitely we do know, or we hypothesize, but I do think most of my colleagues would agree that there are conditions where you can get just like an imbalance in the microbiome of the gut.
Mm-hmm.
You can get an imbalance
Yeah.
in the microbiome of the breast. So the breast also has a microbiome. They've got little cells that travel to the mum's gut, picks up
Mm-hmm.
bacteria and
Yeah.
brings it back to the breast to deposit into
Yeah.
breast milk.
Mm-hmm.
So we talk about gut dysbiosis. So we also talk about ductal dysbiosis and imbalance. I think the tricky thing is, and so if you have gut dysbiosis, using probiotics can be helpful, depending upon the strains and what's going on for the individual. But I think the thing is that the gut microbiome is so unique. It's as unique as a fingerprint. And I
Mm.
think I would suspect that the breast microbiome is also quite nuanced.
Yeah.
And so when we use probiotics, we're sort of using them willy-nilly with certain
Yeah.
strains that we think might help.
Yeah.
And I think for some women it does, but I think for the vast majority, I see a lot of women paying a lot of money for
Mm.
probiotics and not
Yeah.
having
It's
that
like
much.
throwing spaghetti against a wall and hoping something sticks,
Yes.
but it's
And
very
I think,
expensive.
yeah, it's
Mm.
really expensive. And I have mixed feelings about it because I'm very pro um, things that will foster the microbiome and good probiotics. But I don't like it when you have a vulnerable group of people who are
Yeah.
really worried about getting mastitis and then companies monetize
Yeah.
this.
Yeah.
And there's a lot of that in
Yeah.
postpartum care. I think probiotics is part of that. And I think the ductal dysbiosis is a small group.
Yeah.
That's a subset. I
Okay.
think really good mastitis management is really, we can talk about it, but really
Let's
good
go. Yep.
breast and all of the other bits and pieces of. But I
Yeah.
think the probiotics are an adjunct. They're not the primary management. And so
Mm-hmm.
if you're not getting to the root cause of why this person is getting mastitis or recurrent mastitis,
Yeah.
um, then taking a probiotic may not be that
Yeah.
effective. Yeah.
Okay. Now, it's been this topic's been a lot more well, not complicated. Like I know it's complicated, but yeah, it's really nuanced, isn't it?
It
Okay,
is.
so
I
let's
hope people like detail. They listen to a
that
podcast to hear some detail. So
absolutely. I'm sure that's why they've come to this
hopefully.
episode. That's it, ladies. Hope you enjoyed that fabulous session all about mastitis with Dr. Nicole Gale. And be sure to share it with a friend who might be beginning their breastfeeding journey or going through their breastfeeding journey and having concerns about mastitis, because I trust it'll be really helpful for them too. Thank you so much for joining us today. And I look forward to hearing from you. Come and send me a message on Instagram at kathbequee.physio if you enjoyed this episode. Thanks, ladies. Thanks for listening to the Fitness Mama podcast, brought to you by the Fitness Mama freebies found at www.fitnessmama.com/free. So please take a few seconds to leave a review, subscribe so you don't miss an episode, and be sure to take a screenshot of this podcast, upload it to your social media, and tag me at Fitness Mama so I can give you a shout out too. Until next time, remember, an active pregnancy, confident childbirth,
and strong postnatal recovery is something that you deserve. Remember our disclaimer, materials and contents in this podcast are intended as general information only and shouldn't substitute any medical advice, diagnosis or treatment. I'll see you soon.